Hello, everyone. I'll be spending the next few minutes discussing a new drug delivery system for treating osteoarthritis. So this athlete just had her ACL ruptured. Like 80% of people with such injuries, she will most probably develop osteoarthritis within 8 to 10 years. And this is actually very common among young active people like runners, dancers, high school athletes. So what happens in a joint injury is that this white-colored tissue, cartilage, that provides cushioning between the two joints gets severely degenerated. A joint injury triggers a biological response because of which this nice-looking cartilage begins to degenerate, and then over a period of time, it might start looking something like this. This is when the patient starts experiencing osteoarthritis symptoms like pain, inflammation, immobility. The problem here is that by this time, it's often too late, and the only option left for the patient is to get a joint replacement. So this disease affects over 150 million people around the world, but unfortunately, we do not have a cure for it yet. And the current treatment options, they only provide a short-term pain inflammation relief, but they do not do anything to treat the problem. There are a variety of dietary supplements. I'm sure some of you have heard about them or even used them, and they've been proven to be ineffective again and again. And despite of all this, the patients continue to spend over $7 billion on these medications every year. And this is the market size that osteoarthritis presents for us. So what can we do about this problem? How about we prevent osteoarthritis even before it starts? So what we want to do is to intervene early on, right after a joint injury. And you can think of this as a vaccine that could be given to the patient right after an injury as a precaution against developing osteoarthritis. And this vaccine will comprise of a drug combination that our lab has developed, and it consists of an anti-catabolic agent, a drug that prevents further degradation of cartilage, and a pro-anabolic growth factor, a drug that helps the degraded cartilage to regrow back. So what you see here on the y-axis is the Gag Loss, and without going into much details, I'll just say that Gag is the good stuff in our cartilage. When we treated our normal cartilage samples with or without the drug, as expected, we did not see any difference in the Gag loss. However, when we injured our cartilage samples, the Gag loss significantly increased. When we treated these cartilage samples with our drug combination, the Gag loss reduced and it came back to normal levels. So this is very exciting, extremely promising. And now the question is, how can we deliver this potent drug combination locally and safely into the joint so that it will have minimal side effects, one, and also it will be able to reach the cartilage, which is a very complex tissue, and it's very different from most other tissues in our body. It's dense, it's extremely negatively charged, and it also does not have any blood vessels. So what we want to do is to encapsulate this drug combination into nano-sized particles and then introduce them into the joint using intra-articular injections locally. So these particles, of course, will have to penetrate into the deep zones of cartilage, a very important criteria for the system to be successful. And also, it will have to go and bind with the tissue so that it can stay there for a long period of time and provide a sustained drug release. So there's two important parameters here. One, the size of the particle, what size can go in, and second, the surface properties. We have shown that ideal size for these particles will have to be 7 to 10 nanometers in diameter, which is small. What you're looking at here is the cartilage slices, and the red arrows show the direction of penetration of the particles. As you can see from the color of the images, 15 nanometer sized particles are too large to penetrate, as most of them are staying just on the surface of these cartilage slices. One challenge with using too small particles, like 4 nanometer ones, is that once they are in a joint, they will get cleared out very quickly. So this is the ideal size range that will work. As you can see, the rate of transport of these particles is much smaller than the smaller particles. So what could we do to enhance this rate of transport? We've also shown that we could utilize the electrostatic interactions to enhance this transport. As I said, that cartilage is heavily negatively charged. We experimented with a heavily positively charged protein, avidin, about 7 nanometers in diameter. And we found that within 1 day, avidin was able to penetrate all the way through the full thickness of cartilage tissue. As compared to its neutral counterpart, same size, similar structure, but electrically neutral. And you can see in 4 days, it did not even penetrate halfway into the cartilage thickness. We also conducted desorption studies, which suggested that avidin can stay inside the cartilage for greater than 15 days, the kind of retention we are looking at. So what we have shown is that the ideal drug carriers for penetration into cartilage will have to be 7 to 10 nanometers in diameter with a strong positive charge, mimicking the structure of avidin. And the structure is now a pending patent. Currently, we are making these structures and encapsulating our anti-catabolic agent and also tethering our pro-anabolic growth factor on the surface of these particles and testing their biological response using our in vitro cartilage models. And we hope to get into animal studies sometime soon. So with that, I'm going to actually stop here, and I hope that during the conference, we'll get a chance to talk to some of you and discuss this further. Thank you.